I hope everyone can see that. Okay. So the focus of our discussion or lesson for today is just take a look at what a referral letter is and what a set of case notes about a referral would look like. What are the typical elements? So your writing case notes would often give you the introduction, um, a short background of who your patient is, and your role to the patient's care. So this is found at the very top of your case note. And also, an update with regards to OET writing subtests. The writing test would now clearly tell you which date to write in your letter. Okay, this is pretty recent. So, for example, if you haven't taken the test yet, okay, so this is something for you to note. If you've taken the test prior to this update, then you can now see which date OET wants you to use for the letter. In this example, the patient is a Mr. William McGuire, and the introduction also gives you his date of birth, 23 May 1956. So we have an elderly patient, and Mr. McGuire is a patient in your general practice. So in this case, your role here is the GP. And of course, after reading it, okay, the very last note, yeah, will be your actual writing task. So I'll give you maybe a few seconds, half a minute to have a look at the writing task, and we can discuss. Dr. Tatiana, is this something that you've already seen before, Mr. William McGuire?
Yeah.
You have? Yeah. Okay. Have you already written a letter about this case?
Yeah.
You have as well?
Yeah.
Yeah. Do you distinctly remember it?
Yeah.
Okay. Right. Okay with you for us to discuss this, to use this case as a referral? For the
Yes,
referral?
of course. Yeah, of course.
All right. Okay. Right. So in a lot of cases, the writing task would tell you what type of letter to write. In this case, it does tell us that. It says to write a letter of referral. And of course, the writing task would always give you who you will be writing to. So who is your reader? In this case, you are expected to write to a respiratory physician. That's a Dr. Sutton. And the writing task often also gives you what is the general purpose of your letter. And here it gives you the general purpose, which is to seek for follow-up assessment and also for advice on management. So you're looking for two things. You're wanting to ask for a follow-up assessment, and you're also wanting to ask for advice on management. So the writing task is very important because it allows you to be ready with thinking about what role will the reader have on your patient's care. And thinking about that, it allows you to then narrow it down to the kind of information that will be relevant to this reader, the respiratory physician. Okay, right. Now, let's take a look at the notes directly above it, okay? So when you're reading your referral letter, how do you normally read it, Dr. Tatiana?
Normally, I read it firstly what I need to do and where what is the letter is. This letter is referral, and to whom, to respiratory physician, and for what they want us to do.
Yeah, so you always start with the writing task.
Yeah.
Yeah, and then do you typically as well orientate yourself with what is your role in this case?
Yeah, I'm here. Yeah, general practitioner.
Right. And then what's the next part that you read? Is it the notes directly above the writing task, which is this part?
Yeah, I'm writing
Or do
plan,
you start from Mhm.
plan assessment. Yeah, plan assessment, and then I read all notes.
All right, okay. So that's a pretty good strategy, okay, because the notes directly above the writing task, okay, typically would tell you the specific details or the specific reasons or purpose for writing. So you have a plan here. So this is the plan that you're making as the GP for your patient. I think that's Dr. Rosefa. Dr. Rosefa said that he will join us as soon as he is able to connect, I think using his laptop. That's okay, Dr. Rosefa. Right. There are three things under the plan. Of course, bearing in mind, you're now reading the case note, bearing in mind who you're writing to and why are you writing. So if you remember, okay, we use this type of a sort of a strategy for introduction. Yeah. The things that you want to really put in your introduction would, of course, be the type of letter and also the reason why you're writing or the purpose. Okay. So immediately the examiner would want to see why are you writing the letter. So these two things, there will be additional things there later as we try to um, write a letter. Okay. So let's take a look at the plan. Because it's a respiratory specialist that you are writing to, is everything on this plan relevant to the reader, Dr. Tatiana?
For the reader, just relevant um, assessment, advice, and management.
Yeah, this part here, which is a question mark,
Psychologist. This is for
yeah, for
psychologists.
depression treatment, this will be outside the scope of specialization of the reader, right? Yeah. So
Yeah.
what this would mean is maybe as the GP, as the GP of the patient, Dr. Tatiana, you'll probably be maybe writing another referral letter.
Yeah.
Yeah.
As a GP for the psychologist.
Yes, correct. Yeah. So this first line here is for another specialist, the psychologist. But clearly, the scope will be under this line here, okay, which is the referral to respiratory specialist for assessment and advice. We can notice here that there's now specific advice that you're wanting to ask from the doctor. You have here a question mark. So this is definitely something that you want to ask.
Yeah.
You're asking for advice. Does the patient need intensification of treatment, or will the patient be needing home oxygen therapy? Yeah. So two things. Okay. Now, we want to, of course, read the rest of the case note. Okay. Again, always bearing in mind who your reader is. Okay. So let me just show you the part, Dr. Tatiana, from patient details, just up to immunization information. Could you tell me whether there's anything relevant here that you wish to share to the respiratory specialist?
Ex-smoker 40 cigarettes a day for 40 years, and he quit 5 years ago. And his background, social background, and also his family history, where his two of his sisters was having problem. One COPD, another one bronchiectasis.
Yeah.
So this is one.
Okay, so two things. And anything about immunization as well?
Yeah, and he was immunized. Yeah, that, and he no known allergies as well. He's up to date.
So this would be relevant for the specialist to know as well. Yeah. All right. Okay. Now let's take a look at from past medical history. we can see here that we seem to have more than one set of dates. And whenever that happens, dates in a case note are very important because it allows you to make sense of, so what happened during this timeline? Okay. So we could see here that the past medical history is about a 2017 gout. Yeah.
It's
So
not
this one is
non-relevant.
older. Yeah, it's not going to be relevant. So now let's take a look at these 3 dates here under the history of presenting complaint. Okay, right. So remember that today's date is October of 2021. And the history that you're now looking at is more or less 2 years old. Right, doctor?
Yeah.
Yeah, okay, right. So what happened on August 2019? What will be relevant there to mention to the specialist?
And that he was actually diagnosed with COPD.
Yeah.
And he
So the
was, 4-month history of chronic cough, and he was diagnosed.
Okay, right. So that was back in 2019. Okay. And what about September 2020? This is now over or a year later from the first time he was diagnosed with COPD, right?
But it was exacerbation of COPD. So and second one as well. So he was hospitalized during 1 year twice
Yeah.
for the same problem.
Yeah. And apart from hospitalization for September 2020, would you also be mentioning how he was treated?
Yes, with IV antibiotics.
Yeah, that will be relevant as well. Because again, you're writing to ask for advice for management and treatment. So the specialist would expect that you will also be providing a history of how he was treated in the past. Yeah. What about July 2021?
So it was second exacerbation of COPD and also hospitalization with IV antibiotics. And followed by 6-week course of rehabilitation with physio. It will be mentioned as well.
All right. Okay. Right. So we could see here that he was also managed with antibiotics, similar to the first incidence of hospitalization in September 2020. The difference with July 2021 is there's now specific information as to the type of antibiotics that were given. And then there was additional management of a 6-week course of pulmonary rehabilitation with a physio. Yeah. So, okay. So clearly relevant to the medical specialist. Let's take a look at medications then. Of course, everything to do with the COPD. Yeah. Is there any information here which is redundant or has been mentioned initially?
So he was starting on salbutamol and 2 of them, salbutamol and salmeterse.
So at the moment, he's currently taking this 3. Okay, all right. Okay, that's for the COPD. Yeah, the gout, something outside the scope of the reader's specialization. Yeah? Would that be relevant, doctor?
No.
All right. Okay. Now let's take a look. This is now the current presenting complaint. So before we were looking at historical information. Okay, so from July 2020, which was the last hospitalization, he now shows up at the GP a few months later, October 6, 2021. Okay, we could see here that it's a long set of notes for this current presenting complaint. because this is precisely why you're writing for a referral, because something here is you're needing help from the specialist. So let's take a look at the subjective first. Is there anything here under the subjective which will be relevant?
Yeah, slowly increased dyspnea since
Yes.
last hospital admission.
Mm-hmm.
With also with decreased ADL.
Okay. Would that be relevant, doctor?
Yeah.
Yeah. Okay. Would that be, for example, if you're ranking it, would that be one of the most important information the respiratory specialist would want to know? The decreased ADL.
Yeah.
Mm-hmm. Right.
Of course, we need to mention that he lost of appetite and he has anxiety as well.
Mm-hmm. Yeah. Okay. Right. But okay. I'm just thinking this is about ADL. Yeah. Okay. Right. Okay. We'll see about where we can organize this one. Yeah. Okay. And then you can see here that there seems to be, this is where you seem to be diagnosing him with depression provisionally because of the question mark. Yeah. Increased anxiety, and maybe he is experiencing depression. Okay. What about your objective notes? What would be relevant here?
Increased resonance.
Yes.
Hyperinflation. First one. Hyperinflation. Yeah. The same chest expansion as well.
Yeah. This one, no wheezes and crepitations. Would that be relevant to mention even though there's none? Sometimes not having any symptoms.
Normally we not mention, but for him maybe it will be important, so we can mention it. It's no wheezes.
Yeah. Okay.
So it doesn't have any.
Anything else, doctor?
Chest expansion and low brief sounds as well.
Okay. Anything else here?
Nothing else.
Okay. Now let's take a look at the, so you did some tests. Okay. So certainly all these tests, okay, all relating to his complaint, right? The increase in this dyspnea, okay? And the tests for ECG is normal, yeah. But what? Yeah, but
We
what
don't
would
need to
be?
mention.
Yeah, you don't need to mention that. That's for the ECG. Anything significant here, doctor?
Peak expiratory flow rate.
Yes.
Chest
So
X-ray
for
probably
values
we need
there.
to mention as well.
Yeah.
Chest X-ray.
Okay, so that you didn't chest X-ray, but it's there's no result for this condition. Yeah. Okay. All right. Okay. So we could see here very quickly. Okay, Dr. Josefa, are you able to join us now?
Yes.
Yes.
I'm following.
Yeah. Sorry, I wasn't familiar with the other login for Zoom.
Yeah,
So sorry about.
I was using my phone and I was driving with my children, so too much noise. Then when I just joined from home, yeah.
All right. Okay. I was wondering who's HSM. Okay.
Yes, yeah. This is for
Your initials.
my name is there, yeah, Joseph Suleiman, yeah.
Okay.
Yes.
The case that we're looking at, Dr. Josefa, is a referral letter for a patient named Mr. William McGuire. Okay. Is this something that you're familiar with, Dr.
Actually,
Josefa?
For writing,
You
no.
have?
No, unfortunately.
Sorry,
Yeah, I
you
didn't
haven't read
check
this case
writing.
yet.
Even writing, I never wrote a letter yet.
All right. Okay. All right. So you're starting from scratch.
Yeah, right.
All right. Okay. So we did some discussion earlier. Okay. It will be recorded anyway. So I'd like you to just, have a listen. Yeah. Dr. Tatiana has managed to read about this case previously and has also written a letter about this. And I think we did a practice about writing an introduction for this one as well, Dr. Tatiana, if I remember correctly.
Yeah.
Yeah, I think
Yeah. All right.
she's doing great. I prefer to follow. Okay.
Yes, she is.
Okay.
Right. Okay. So, just a little bit of recap, if Dr. Tatiana doesn't mind. Okay. When you see the writing case note, the writing case note will, at the top of the page, will give you a little bit of background of who your patient is and what is your role in the patient's care. Okay, so in this example, the first information that we have here under notes tells us what today's date is supposed to be. So we're assuming that today's date is the 6th of October 2021. Okay, before, we rely on the date using the latest date or the date of discharge sometimes in the case note, right, Dr. Tatiana?
Yeah.
Do you, yeah, it's much, I think it's much appreciated by candidates of OET that they've now made it clear, okay, what date the students or the candidates are supposed to use. So you now have that here. So on the notes as well is you have the patient's full name, Mr. William McGuire. You have a date of birth, and it also tells you what is your role here. So you are the GP, you are his GP, a family doctor. So a GP would give you an assumption of a level of familiarity with your patient. Would you agree, Dr. Ruseifa?
Yes, he knows the patient. Yeah.
Yeah. And so after which we really want to just have have a read of the very last information on the case note, because this is where you will find, okay, most of the time the writing task will tell you what type of letter you're supposed to write. In this example, it tells us that you're supposed to write a letter of referral, and most importantly, it tells you who you're writing to, a respiratory physician. So that already gives you an indication what the case is about. So something to do, some problem about the respiratory, because the referral is for the respiratory specialist. And the writing task, okay, in a lot of cases would also tell you the main purpose why you're writing. And the main purpose you're writing here is to ask for follow-up assessment and also to ask for advice on how to manage the patient. Okay, quite general. And we were just discussing it earlier that Dr. Tatiana would also, okay, as a good practice, instead of reading from top to bottom, will probably have a look at the notes directly above the writing task, because it gives you the most current information. You will notice here, doctor, that we only um, um, box in the information which is on the second line, refer to respiratory specialist for assessment and advice. There are two question marks here. Okay, so this is your primary questions to the respiratory physician. Does your patient need intensification of treatment? And will your patient need home oxygen therapy? This first line here, which is about psychologists for depression treatment, would not be directly relevant to the respiratory physician because this would be outside the scope of specialization. It's possible that this is your plan because aside from showing some respiratory problems, your patient may also be experiencing some depression. And therefore, this may be another referral letter that you would write, this time to a psychologist. But you don't really need to mention that to the respiratory physician. Yeah, because you wouldn't know what to do with it. But as a GP, okay, your management of the patient would be more holistic. Any questions so far, Dr. Seifa?
It's okay.
Okay, right. And so Dr. Tatiana also identified the relevant information according to why you're writing and who you're writing to. Okay, because the reader is someone who is not familiar with the case of the patient. Okay, it's a good idea to give the reader some background about the patient, which is going to be relevant to his assessment of Mr. McGuire. For example, letting the reader know that Mr. McGuire is an ex-smoker and he used to smoke 40 cigarettes a day, okay, but he quit 5 years ago. Also will be relevant to mention about the family history of two sisters, okay, having COPD and the other one having another condition, yeah, bronchitis, and then giving information about his immunization and also that he has no known allergies. Because sort of you're introducing your patient to this person because they don't know each other. The specialist is not familiar. So now what we're going to do first is, so the first 5 minutes will be all about reading. And you're not allowed to write anything. You're not allowed to underline anything. You're expected to just try to get a sense of what is the reason you're writing and what would be the relevant points there. After the 5-minute reading time, you will now be given 40 minutes to write the letter. Obviously, you don't want to immediately write the letter because this time you actually want to maybe make some notes, highlight, underline. Is that okay, Dr. Seifa?
Yeah.
And also, after picking the relevant information, you now want to make a plan. You want to make a structure of what your letter would look like. Because you are expected to write a formal letter, you are expected to write in paragraph form and a structure. And of course, any letter would always have your introduction. So I always, use the analogy of think of it as like a sandwich, could be a chicken sandwich. A sandwich would always have a bun or a bread on top. That's your introduction. Yeah. And then, of course, your sandwich will have a bun at the bottom. Okay. And we call that your concluding paragraph. So these are the basic paragraphs. And of course, everything in the middle will be the meat or the actual filling. Yeah. We expect that we will only have one bread at the top, the introduction. We would expect that we would have one concluding paragraph, but in the middle, you probably would want for the chicken sandwich to be more delicious or to be tastier. Okay, you probably would want to put there some more ingredients. Maybe you want to put there maybe some butter. Yeah,
So some
some
relatives,
lettuce.
some relevant spices. Yeah.
Correct. Yeah. So therefore, the middle part of your letter, okay, could be more than, or you are expected to have more than one paragraph. This time we can refer to it as a body paragraph. So you can have a body paragraph 1, maybe that's your lettuce, okay, all about lettuce. And then maybe you can have a body paragraph 2, and let's say another body paragraph 3, okay? Um, you are not limited to just 3 paragraphs or 2 paragraphs, depending on how you wish to structure or how you want to organize it. It's always dependent on the case anyway. But you are expected to write within the guided word count, which is between 180 and 200 words. Okay. So unlike other English tests where you might be penalized for writing below the minimum limit. OET doesn't have a sort of minimum limit, okay? But what it tells you is if you are writing less than 180 and it's significantly lower than 180, maybe you've only written 140, what that tells you is maybe you're missing some important points. If you are, let's say, writing over 200, that's not going to be a problem as long as it's not too significantly too much. That maybe what that could tell you is maybe you're already including information which is not going to be relevant for the reader. For example, if you are maybe discussing too much about the depression, the respiratory physician upon reading the letter might say, well, what does he expect me to do about it? I'm not a psychologist, okay? I'm not an expert on this subject. So that would be totally irrelevant. That tells you that maybe, okay, there are some extra information that are not supposed to be there. Okay, Dr. Seifa?
Yeah.
Right. Okay. Now the question is, okay, let's go ahead and start by writing the introduction. Okay. Right. So in the introduction, if you don't mind, let me just remove that first. The introduction, okay, we have what we call your intro 1, 2, 3, 4, and sometimes even a 5. Do you remember, Dr. Tatiana?
Yeah.
Yeah, okay. So these are sets of information that in general you are expected to provide, you're expected to write in your introduction. And of course, okay, as part of your introduction, you want to state there the name of your patient. Okay, in the introduction paragraph. In the introduction paragraph, no need to state the full name. So just the title, Mr., Mrs., and then just the last name. If you have a patient who's an adult. But patients who are 16 and below, okay, you can refer to them using their first name. Okay, everyone. The second set of information that you are expected to write in the introduction would be the type of letter. What type of letter are we writing, Dr. Seifa?
It's a referral letter.
Yeah, a referral. Okay. So meaning you are expected to use a phrase that would indicate to the reader that this is a referral. Okay. And then for number 3, okay, we want to give an overview, meaning a very quick snapshot of the medical, maybe the medical problem or the issue. Yeah. In some cases where the patient has been admitted and you're probably writing as someone from a hospital doctor, okay, maybe here you might write about what was the reason for the admission. Was there any procedure done? Yeah, that could be an overview. Okay. In this case, it's a consultation that he had with yourself today at the GP. Yeah. And the presenting problem, okay, would be what you have here, the current presenting complaint. So we will use that. That's number 3. Okay. For number 4, okay, this would be where you would write the purpose, the reason you're writing. And we already have that based from our writing task. What is our 2 main purpose again, Dr. Tatiana?
What is relevant to the reader purpose? So this is assessment and advice.
Correct, assessment and advice. Okay. So the referral is to ask for follow-up assessment and advice on management. Sometimes, in some cases, okay, OET would put something there which they call the sort of the problematic issue. Okay, maybe there's an extra issue there that you would need to write under number 5 for introduction. Yeah, it could be something like I'm just thinking, maybe, for example, if you're writing as an ER doctor and the patient was admitted to the ED or the ER because he was involved in a house fire. Yeah. So even and you're in this example, you're the ER doctor and you will be writing to the GP. So even if the GP is already familiar with the patient, it's possible that the GP was not aware that the patient, his patient or her patient was involved in a house fire. Is that fair to say, Dr. Seifa?
Okay.
Yeah, so that means that that could be something that you would need to put for number 5 on the introduction. But in this case, there's nothing quite problematic. Okay, the main issue here is to ask for follow-up assessment. Okay, what I'm just saying is that there are some cases where you might need some extra information apart from all 4 of these. Yeah. Okay, so now let's try to go ahead and write our introduction. Okay, let me just move that there. Okay, right. So there are more than one way of writing a referral. Could you give me a phrase, Dr. Tatiana, using a phrase to show that this is a referral letter?
I'm writing to refer.
Yeah, okay. So it could be as simple as I am writing to refer. Yeah, okay. Any other phrases, Dr. Seifa?
Yeah, like thank you for seeing, Mister.
Yeah, okay, very polite. Thank you
Yeah.
for seeing.
Yeah.
Okay. Anything else?
May I refer?
We tend not to present our request in the form of a question. Okay. It's better
Because
to use a sentence.
yeah, because actually this is what we use here, you know, so I have to
That's
change.
right. Yeah. But for OET, they would
Yeah.
prefer that it's presented in the form of a statement, doctor.
Okay, good.
Okay. Still polite, but yeah, but no question. Anything else, Dr. Tatiana?
Requires what he requires, just patient requires.
Yeah. How would he know that it's a referral? Maybe we could say, so here we call this the active tense.
Thank you
It's
for
an
seeing
Go ahead.
that he requires.
Yeah.
Like,
So maybe we can start with the name of the patient first, Mr.
yeah.
McGuire.
Is being referred.
Correct. Yeah. Okay. So now this time we call this the passive tense. Yeah. Because here, okay, you're not indicating who is doing the referral. Okay. You are immediately saying who you're referring to the reader. Okay. So there's again in the introduction, okay, between these two, I am writing to refer, Mr. McGuire is being referred, okay, both are correct, okay. Maybe the difference is that using the passive tense, okay, would probably give you a better mark for grammar because passive tense is more advanced and passive tense is also more formal. Okay, but again, the introduction is about the examiner wanting to know whether you've written the purpose. So that's okay. Now, the second one, thank you for seeing, is another good option as well because it's very polite. And you are expected to write a formal but polite letter. Okay, so thank you for seeing, Mr. McGuire. Okay, right. So which one would you like to pick? Dr. Josefa, do you want to stick with your suggestion? Thank you for seeing.
Because I'm usually using this one.
All right, good. Okay. What about you, Dr. Tatiana, you're more comfortable using the first one, I'm writing to refer?
No, I think I'm more comfortable using the first name patient. Mr. McGuire is being referred.
Okay, good. Okay, right. So let me just go ahead and delete this one. Okay. And then maybe, okay, I can ask Dr. Tatiana to give us her version of the introduction first, and then I can ask Dr. Josefa. So at least Dr. Josefa will have some ideas. Yeah.
Mr. McGuire is being referred for your follow-up assessment and advice on treatment.
Yeah. Is being referred for follow-up.
For follow-up assessment and advice on treatment.
Mhm.
For his decreased respiratory function with significant diminished activities of daily living.
Yeah, let's think about the linking word to link the problem with this statement. What could be a good linking word there, doctor? If you're linking a situation or let's say a diagnosis, what's a good linking word? Sorry? Sorry? For? Let's try that. Mr. McGuire is being referred for follow-up assessment and advice on treatment for. Yeah. Because you already used for there, it might look repetitive.
Yeah. For follow-up assessment and advice on treatment.
Yeah.
And
you
maybe
could use following or due to. That's a good.
Due to decreased respiratory function.
Correct. Yeah, good one. Decrease respiratory function. Respiratory function. Okay. So either one is fine. Either use following, okay, or due to. Okay, Dr. Tatiana?
Yeah.
Yeah. So would that cover, let's check whether you have your 1, 2, 3, 4. Definitely you have the name of the patient. Okay. You have the phrase indicating it's a referral. Okay. You have an overview of the medical problem, the decreased respiratory function. Yeah. And you have the requests for your reason for writing, follow-up assessment and advice. Yeah. So far, so good. Yeah. You okay with that, doctor?
Yeah.
Okay.
It's better than.
Yeah, and it's quite short as well. It's direct to the point. Yeah. Still polite. Okay. Right. Now, would Dr. Seifa, would you like to have a go at the introduction?
Yes, I think I'll start with, I will make the both request. So I'll start with thank you for seeing Mr. McGuire, who is being referred, and the rest of the sentence said by Dr. Tatiana.
Okay, all right. So what you're planning is, thank you for seeing Mr. McGuire, who is being referred. Yeah. But that might be redundant, that might be repetitive, because the phrase thank you for seeing is already your phrase for the type of letter, referral.
Okay.
Yeah. So, okay, maybe here, okay, you could indicate why he would need to see Mr. McGuire rather than repeating the he's being referred. Okay, what about giving an overview of the medical condition first? You can use a linking word, okay, to describe Mr. McGuire. So you could use who.
Yes.
Yeah, go ahead, Dr. Seifa. Thank you for seeing Mr. McGuire, who you will now be explaining here what the problem is.
Who is having a decreased respiratory function?
All right. Okay, I'm going to point out this one. If you remember our discussion, our lesson on formal and informal language, have, has, had, informal, isn't it, doctor?
Yeah, so better to who has been diagnosed or.
Right. Okay. The situation here is that today you've seen the patient, okay, and these were the results. Yeah. So your assessment falls under decreased respiratory function. Okay. There's also significant decrease in ADL and even mild depression. But the major factor here would be the respiratory function. So that's what you want to write there, doctor. What could be
Yeah.
another, instead of decrease, let's try to use another adjective because I think Dr. Tatiana used decrease. Let's look for another adjective.
Reduced.
Yes,
This
reduce.
yeah.
Yeah, okay. Right. Okay. So who
Has been diagnosed. Oh,
okay, right. Would diagnose be the,
yeah.
because that's not a
It's not,
condition
it's not,
yet.
it's not a diagnosis. Yeah, we are describing what happened, but not a diagnosis.
Yeah. So maybe we could say,
Who's suffering?
yeah. OET tends not a big fan of the word suffering unless the condition you're describing is chronic. Someone that suffers from, like arthritis. Yeah. Okay. I think in this case it's chronic, but we tend to shy away from using the word suffering too much, right, Dr. Tatiana?
Okay.
Yeah.
Yeah, they're not a big fan of that word. My suggestion is you could say, remember, this referral is a result of your consultation today. Mr. McGuire showing up today. Yeah, so you could say, thank you for seeing Mr. McGuire who presented today. Yeah. What did he present today? You said reduce
Reduced, yes, respiratory function.
respiratory function. Okay. Yeah. Okay. And then, okay, so this time you want to make 2 sentences instead of just one. The first one is just very polite. Introduce what the Mr. McGuire's problem is. On the second sentence, you are now wanting to state your purpose. Yeah. How would you state your purpose? You can just use the pronoun he,
He needs
or you could say your. What is your purpose?
your further follow-up assessment and advice.
Your further assessment.
Yeah.
You don't want to use your further and follow-up because that would be repetitive.
Assessment and advice
Good.
is requested like that.
And advice on
And
treatment.
treatment is highly appreciated.
Okay. Is highly appreciated. Okay. Is okay. Right. We want to use a modal verb here because we want to be polite. Yeah. So you could use would be.
Yeah. Highly appreciated.
Highly appreciated.
Right.
Okay. Dr. Seifa?
Yeah, looks very
Happy
nice
with
now.
that?
Yeah.
Okay. Right. So because the introduction is really the first thing that the examiner would read from your letter, you really want to make a good first impression. So doing a good practice of the introduction, okay, is definitely something that would really be beneficial for you. Yeah. And your introduction also sets a very good tone to your letter. Now, because this is a referral, okay, remember that you are also expected to write a concluding paragraph, right? And in a referral, okay, we tend to have a concluding paragraph, which is, we call it, if you don't mind, let me just go ahead and maybe move here. Yeah. So this time, okay, we're not looking at the body yet, okay, because the body would take time to write. Yeah. So for now, our lesson would just be focusing on writing the introduction for a referral and how do you write the concluding paragraph, the last paragraph for a referral. Okay. So this is for a referral. Okay. Most of the time, not for discharge. Discharge will be something different. So if it's a referral, we tend to do this technique of mirroring. Okay. Mirroring means that because you want to be polite and you just want to make sure that you were able to restate your request, you want to mirror back the requests that you made on the introduction on your concluding paragraph. Yeah. What was your request here for Dr. Seifa? The request is your further assessment and advice on treatment would be highly appreciated. Dr. Tatiana is for follow-up assessment and advice on treatment. Okay, something very similar. So because we're mirroring it, you don't want to copy everything. Yeah, you want to maybe sort of paraphrase it so you're still getting a good mark for language. Okay, so what could be, Dr. Tatiana, what's another word that you can paraphrase assessment?
Assessment.
Mhm.
Let me think. Diagnosis.
Diagnosis. What else? Maybe evaluation.
Evaluation. Yeah.
Yeah. Okay. Right. So you will use evaluation. What about advice or treatment? What is your paraphrase here?
Management.
Yeah. Management. Yeah.
Advice
Advice
on
and
management.
management. Okay. So we're going to use that. Okay. Right. Sorry. Okay. Right. Okay. So for Dr. Tatiana, okay. Oh, it doesn't want me to write anything. Bear with me. Okay. So your concluding paragraph now for Dr. Tatiana would look something like this. Okay. Your so you use here follow-up assessment. So maybe you can borrow the word from Dr. Josefa, your further evaluation and advice on management. Yeah, okay. If you go back to the last bit here, it actually tells you the specific questions you have about the management. Yeah. So in fact, you can actually use this so that you can really specify what your questions are. So intensification of treatment and home oxygen therapy. Okay, so we can use that. Okay, sometimes there's nothing specific, it will be general. So it's just a matter of paraphrasing it. But in this case, because we have specific questions, you could use that as well. Your further evaluation advice on management, okay, for intensification, yeah, intensification of treatment, okay, and or home oxygen therapy, okay, would be highly appreciated. Okay, Dr. Tatiana?
Yeah.
Yeah, okay, right. So now let's take a look at Dr. Josefa's. Okay, I'm going to move this because this will be Dr. Tatiana. Okay, that's under introduction. Okay, now remember you're going to mirror this part here, Dr. Josefa. Yeah. So instead of further assessment, what could you use? Review as well is a sort of assessment, isn't it, doctor? The word review. Yeah. That's a good noun as well. Dr. Seifa?
I was talking while mute. I was thinking of an expert evaluation or review.
Okay, good, yeah. Okay, so because you've already used the structure of your further evaluation, we don't want to use the same structure on your concluding paragraph. You want to change it a little bit. Dr. Tatiana is okay to use that because she didn't use that for her introduction. Does that make sense, Dr. Seifa?
Right, yes.
Yeah, so this time, yeah, you could start with a quite a standard one, okay? We often use this to conclude our paragraph. This is very polite. You could start with, it would be, yeah, highly Okay, I think you used the word appreciated here. Yeah. Yeah. So maybe you could even write it in the first person. You could say, I would be grateful. Yeah.
Yes.
I don't think that's the right. I would be grateful, okay, for your expert. Is that what you said, doctor?
Yeah, expert review.
Expert review. And was it advice?
An advice regarding, right?
That's good. And advice regarding maybe a possible intensification. So similar here. Yeah.
Yeah, possible intensification of treatment and or home oxygen therapy. Yes.
Correct. Yeah. Right. Okay. So now the only thing left would be the body, wouldn't it?
Yeah, right.
Yeah. So what I'm going to do is I'm going to upload the case of Mr. William McGuire. For Dr. Tatiana who's already written it, what I want you to focus, Dr. Tatiana, is I don't want you to try to think about this as if it's like a fresh case. And your focus, Dr. Tatiana, would be how do you organize the body? Which one would go first? Yeah.
Yeah, I will do it, but can you send me another case? I will do it from the
Oh,
beginning
yes.
as
Yeah.
well, please.
Do you want? Yeah.
Yes,
Okay.
please.
Well, what I can do is you can just write the letter for a new case. Is that okay, doctor? Don't
Yes,
write
please.
the one for Mr. McGuire.
Yeah,
Okay.
I will write.
Right.
Your case will be more important, more interesting.
Okay. Right. And for Dr. Josefa, what I want you to do, Dr. Josefa, is just try to read the case note first, get a sense of what will be the most important, and then think about how you can organize this into paragraphs. Is that okay?
Okay, good.
Yeah.
Yes.
If you want to attempt writing a letter, the body paragraph, that's fine. Yeah. I will be more than happy to have a look at it.
Okay, good.
Okay. All right. So I hope that gives you a little bit of preview on how to write your introduction and how you mirror your purpose for a referral on the concluding paragraph. And then maybe for your next lesson, okay, you can get more techniques for writing the body paragraphs. Okay.
Okay, okay, good.
Thank you, doctors, as always. And
Okay.
I wish you a very good weekend.